So, welcome to Hurricane Cancer. I wish I could say this is the worst it might get, but it might not. Cancer is, however, like a hurricane sweeping into the lives of many, and I'm extremely grateful to those of you who were willing to join us this morning, taking of the time that I know you need from your families to be equipped for the storm, and also those who were willing to fly in and be with us today. I want to thank Taide for agreeing to be our, I'm not going to say master of ceremony, I'm not going to say mistress of ceremony, our woman of ceremonies, who will help us to run through an ever-changing and evolving agenda as we get news from the storm and we adjust to all of the changes. I'm also incredibly pleased that we have several members of our Board of Trustees here with us. Now, I probably won't have seen all of you, but I certainly know that Barbara is here with us. Thank you very much. And if there's anyone else from our Board of Trustees, despite the hurricane, please stand up and let's thank you for being here and all of your support to our great university. Thank you. I want to especially acknowledge Patty and Alan Herbert, who could not be with us today, but they've given a visionary and catalytic gift in support of women's cancer work at the University of Miami, and that's laid the foundation not only for this symposium, but for a research plan that will take us forward into the future. This gift is in honor of more than 20 years of Patty's battle with breast cancer and how they've continued to fight and work together as a couple. I also want to thank three of the main collaborating organizations, of course, Tómatelo a Pecho, and all of my colleagues and friends at the Unión Latinoamericana contra el Cáncer de la Mujer, who have come from all over Latin and Central America and are willing to brave this storm with us on behalf of women's cancer in the region. Let me tell you, not a single person canceled from ULACAM as of yet, not one. And a very, very special Anna Langer and the Women in Health Initiative. Anna helped me to really push the symposium forward to organize the agenda that we once had that isn't quite what we have now, but that we will have again in the future. And she's been a colleague and friend for a couple of decades now. Am I right? We have also supporters and representatives here. We were very grateful for the gifts and generosity of the American Cancer Society. Very interesting and supportive work to ULACAM, and also thanks to Ambassador Cowell, who will help us to make sure that we have a publication out of this symposium. And maybe that's a way that we can get all the people who couldn't come to actually write and share what they were going to share with us. The Breast Cancer Research Foundation and their co-chair, Kinga Lambert, and the Susan G. Komen Foundation. Unfortunately, their CEO, Judy Salerno, could not be with us, but Susan G. Komen has been a great supporter of this event. I want to thank all of the speakers for joining, but in particular, I want to acknowledge our steering committee, which was very much co-led by Erin Kobitz, who is representing our Sylvester Comprehensive Cancer Center, and who every Wednesday morning, very early, took a walk and talk with me by phone to set up, again, the agenda that you will sort of get today, and that you will continue to receive as we get inputs over and in the future. Anna, as I've already mentioned, Donette Francis from our College of Arts and Sciences, who will be sharing with you later on this morning, we believe, if not in the afternoon, testimonial and a very interdisciplinary perspective. Alejandra Perez, our Breast Cancer Program Director from Sylvester at Plantation, and Brian Slamovitz, also from the Sylvester Comprehensive Cancer Center, who is being incredibly and generously supportive and will share a very innovative program for the Caribbean, and representing colleagues from the Bahamas who could not be here because they are literally weathering the storm. On behalf of Tómatelo a Pecho and ULACAM, we want to thank the sponsorship that was received from Novartis Oncology. Diana Pankeva was especially supportive in this, from Pfizer and from Roche, and particularly Roche Mexico. I want to also acknowledge Patricia San Pedro and her fantastic Doorways exhibit that's outside in the lobby. If you haven't seen it already, please do at one of our breaks. And I know that Patricia will share that with you, as well as her story that's behind that as our cancer dancer. Let me now tell you a little bit about what we're going to be working on today. You are going to hear from some of the leading voices on women's cancers, from clinicians, from patient advocates, and from health system experts. And you're going to hear from them despite the incoming storm, because they believed that it was worth braving the weather to close cancer divides for women. We're here to ask how the movement on women's cancer can contribute to, draw from, and collaborate with the movement on women's health and empowerment, and vice versa. We're here to think especially about the Americas, and especially about what we can do from South Florida. In the time that we will work together, ladies and gentlemen, 39 women will be diagnosed with breast cancer in this state, in the state of Florida. 56 women in Mexico, and 417 in the region that I call home, Latin America and the Caribbean. And in fact, every minute that I've been speaking with you, 3 women received the devastating diagnosis of breast cancer, just as I did in Cuernavaca, Mexico 9 years ago. But some, many, lacking access or late detected, have a different story to tell than the one that I can tell here. And we have to note that in the minute that we've been speaking, 1 woman died somewhere in our world. If those 3 diagnosed women live in Florida, they're all likely to be diagnosed relatively early. And more important, they're very likely to have access to institutions of excellence, like our own Sylvester Comprehensive Cancer Center. And as a result, the vast majority will survive their disease. However, if one of them was undocumented, illiterate, or Black, their likelihood of early detection and effective, affordable access to high-quality care is much lower than if they are white, educated, and employed. If you take a visit to Homestead, as I've done, you'll see how many of our Mexican immigrants and those from other parts of Central America and the Caribbean face a truly different journey when they choose to seek care. If those 3 women that were diagnosed only a few minutes ago live in a relatively resource-poor country, like Bolivia or Guatemala, their chances of survival are a fraction of any of those women who live in Florida. They're in fact significantly more likely to die than they are to survive their disease. Now, there's been tremendous progress in recent decades in combating women's cancers in the United States and indeed throughout the Americas. This is due to better science around prevention, early detection, and treatment, and to the advocacy of many organizations like those that form ULACAM. The most recent research from the American Cancer Society, and I draw on that, and thank you, Sally Cole, for making that possible, and for the American Cancer Society making that possible. The most recent research shows that there's been a 36% decline in mortality in the United States over the last 2 decades. That translates to 249,000 women's lives saved in the last 22 years, and that means 1 woman per hour over the last 2 decades. Another clear indicator of the progress in this country and in the world is that globally, most countries have witnessed tremendous declines in cervical cancer mortality. In Mexico, you'll see the data soon, rates have halved from the mid-1980s until now. The vast majority of women, however, continue to lack access to information, interventions, and available treatments that could have saved their lives. Hundreds of thousands of women globally and tens of thousands in our region die every year from preventable cervical cancer or treatable breast cancer. The majority of them are poor, the majority of them lack access to care, the majority of them are women in the prime of their lives and with children who depend upon them. The improvements in what healthcare is capable of offering women today must inspire us to challenge the diseases of cancer, but also to battle the disparities that still plague underserved population, and even more so, to eradicate the discrimination that prevents women from accessing care. Estimates show that in our region of the Americas, almost 60% of cervical and 50% of breast cancer deaths can be prevented. Research that you'll see later today also clearly shows that cervical cancer is overwhelmingly and increasingly a neglected tropical disease, one that affects almost always poor women. Cervical cancer thus epitomizes the worst in health inequities in our region and our world. But we have the science to change this reality, and money is not the only barrier. The purpose of our symposium today and the research and action projects that will emerge and already underway is to break down some of the greatest barriers that plague work in global health and especially in women's health, those false dichotomies that prevent us from working together. The dichotomies are many, and President Frank Julio, my husband, will speak to these over lunch. They're communicable versus non-communicable, they're disease-specific versus systemic, breast versus cervical, women's cancer versus women's reproductive health. The list of divides is almost limitless, and by contrast, our knowledge and examples of efforts to forge closure to those divides is short and will be summarized succinctly in the presentations we have today from our speakers. Our responses to diseases like breast cancer continue to be fragmented, missing the tremendous opportunities for collective hemispheric action across countries, disciplines, governmental and non-governmental actors, academia, clinicians, and civil society. Women's cancers must become integrated components of our broader efforts to improve the health of women, promote reproductive health, achieve universal health coverage, strengthen health systems, and empower women. Synergistic, diagonal, and effective programs integrate women's cancer into broader health systems and social justice initiatives that engage all actors. It's collaboration across the Americas that will offer tremendous opportunities to develop successful, innovative programs that can be projected globally. Our goal today is identify pathways to that synergistic progress. A word about your agenda. You will notice that it is shorter and much more compact than the agenda that you had in your hands as of Monday. We will use the words fluid and flexible to work with our symposium today. And that will do as we face the oncoming storm. We didn't close off anything. We haven't canceled topics. We have developed a merged agenda. And again, I'm extremely grateful to those who are willing to come and be with us. Let us stop, though, for a moment now, and many times throughout the day, as individuals, to think of those who face and faced that hurricane without resources, the poor of Haiti in particular, the several who we know have already died as a result of this devastating disease, largely because of the poverty that they face. Let us offer our solidarity. Many were devastated, and I guarantee you that there were several among them who had chronic diseases like breast or cervical cancer and will have to continue without treatment for weeks, if not months, as this country travels another journey through devastation. Now, I'll have the distinct pleasure with Aaron to walk you through our opening session, and we have some incredible speakers wonderfully representing all aspects of the university and some of the greatest of the arts. Let me start by introducing a friend and colleague and someone who's supported work on this building and throughout the university, she herself and her family, Debbie Brayman-Weschler. Debbie grew up here in Coral Gables, and after graduating from Boston University, she attended the Fashion Institute of Technology to study jewelry design. A philanthropist, art enthusiast, and active community member, she currently serves as director of the Brayman Family Charitable Foundation. Debbie sits on several boards, including those of the Greater Miami Jewish Federation, Jewish Community Services, and the Lotus House, an Overtown shelter for homeless women and children. She was the co-chair of the Capital Campaign for this beautiful Brayman Miller Center for Jewish Student Life, one that is housing us here today and houses many of our most important events now at the university. Debbie is the trustee of the Institute of Contemporary Art of Miami and also chairs the Art Advisory Committee for the Underline, a project to transform the land below Miami's Metro Rail into a linear park. She and her husband, Jeffrey, a UM alumnus, are notable collectors of contemporary art and the proud parents of 4 children, one of whom is a cane, which, having one now almost, is a big deal here at the University of Miami. Debbie, please join us.